Hello, and welcome to Pets Deserve It. We're your hosts,
Jessica
and Dr. Megan, and thank you so much for tuning in. New episodes drop on the first of every month, and this is our season finale for season one.
Woo-hoo! As you know, we are Latah Creek Animal Hospital, proud to be a premier fear-free certified practice in Spokane, Washington.
And in this podcast, we discuss stress in all aspects of your pet's life. You can check us out right here on YouTube, Apple Podcasts, or Spotify.
We're here to remind you that it doesn't have to be that way.
It doesn't.
So I think today what we're going to talk a lot about is stress and just how toxic it is.
Mm-hmm. Mm-hmm. Yep, we're kind of going to go over a little bit of what?
Buckwheat.
I'm going to leave that in.
Okay. Yeah.
You know what? If you know me, that's what I look like.
Exactly.
So
okay. Back to stress.
Yep. Hair is not stressed anymore.
Nope.
And we're going to kind of wrap up season one and give you some hints about what might be coming in season two.
We've talked a lot about a lot of things in season one. It all revolves around stress, whether that's getting your pet prepared at home, taking them out, and maybe they're stressed in the world, they're stressed at the vet, how to advocate for them, how to alleviate their stress. So much about stress that everyone should be professional stress relievers.
And if you're not, go back and watch the first episodes again.
Yeah, exactly. So why is stress so toxic? I know we've talked about this before, but this is really the basis for all of it.
I'm so glad you asked. Stress causes, it's going to get sciencey for like 30 seconds.
Okay.
Stress causes a spike in cortisol. That's the stress hormone. And that can stay in the system for up to 3 days, but also can help make trauma memories. So even though then the cortisol is gone, the memory of the trauma is often still there. So 3 days plus. When that hormone is in their system, they have increased heart rate, increased blood pressure. It suppresses their immune system. It slows down healing time. It can lead to heart disease, digestive problems, behavioral changes. Trauma weakens your bond with your pet if they always think you're stressing them out. They might not trust you. They might have trauma responses to things in the future. It really is the gift that keeps on giving, one might say. It's not just a second. The procedure or thing that stresses them out might only last a second, but the stress lasts much longer.
Okay, and that's a wrap for the season finale.
Yeah, great. We'll see you next year.
When you mention it just takes a second, I know we've talked about that, but we do hear that every once in a while at this point. We still hear it a little bit, is you want us to go through all this, or you want us to try to give the meds. We need to come in and the appointment takes a while when the vaccine only takes 10 seconds.
And I think that's one of the things that's really a huge difference between pets and us is, to some extent, we can talk ourselves through some of these things.
As people.
Yeah, like let's use getting a vaccine. Some people are terrified of needles and it genuinely does stress them out. Legitimately, but they can also reason that they need this vaccine for XYZ reasons, or they need this shot for this reason, and it can help.
Yeah.
I hate going to the dentist, but it doesn't cause a trauma response. I don't like it, but I know I have to get my teeth cleaned. Right. Dogs don't have that. Cats, bearded dragons, animals, they don't know we're trying to help them. They just know it's weird and scary and painful, and there's no benefit to them that they can see.
Right. So that 10-second shot, 5-second shot impacts a lot of it's very impactful for them.
It is.
In a negative way.
And it's usually, yes, I'm not going to say, oh no, the shot takes longer than 10 seconds. It doesn't, but the visit doesn't take 10 seconds. Even if you're at a high volume, high paced clinic, it's got to take at least 10 or 15 minutes for your whole appointment. That's why a lot of times you can give shots to a pet at home, insulin or what have you, for diabetics, and they still don't like coming to the vet.
Yeah.
It's not really the shot.
Yeah. It's the vet.
It's the vet.
Hi,
it's us.
We're the problem. I know the way we're going to start phrasing it is yes, we'll obviously still be talking about stress, but also their mental health and trying to relate what the pet is going through to what a person might go through. And I know we've also talked a little bit about that, but our hope is that when we say things like your pet's mental health or your pet is dysregulated, that clients, people, pet parents will actually understand that more. Like, oh, I recognize those words being used because maybe my doctor or my spouse's doctor or my kid's doctor use those words about them, but we hear them on TV and stuff, so they might be more familiar.
Yeah.
And then maybe we can relate to our pet's stress better.
I also think it's just the bigger picture too. It's easier to understand why 10 seconds of something can cause all of this dysregulation, and I think it puts it all together and ties it into their physical health as well, because you can't really separate those.
Yeah, we should talk about that a little bit. How their physical health and their mental health have to be considered as a package.
Can I do that with an example?
Yes.
For example, if your cat is peeing in the house, often some veterinarians might say, well, let's see if it's a UTI or if it's behavioral.
Okay.
But it is actually not really that cut and dry, because let's say they do have a bacterial urinary tract infection. Sometimes, yep, they were messy in the litter box and they got an ascending infection. That can happen.
Okay.
More often than not, stress or some kind of mental state in their life led to cystitis, which is just inflammation with no bacteria, because that bladder is one of cats' many stress organs.
Okay.
They have several, but they got stressed out. They got cystitis. Then, because it hurts to go in the box, they start avoiding it and trying to hold it. Then they get a bacterial UTI. So they come to the vet. They do have a UTI. They get maybe antibiotics.
We treat the
UTI. They go home.
Because that's what we can see and recognize.
And then, we check for stones maybe. They don't have stones, the end. But really, stress
and one part.
The physical part, but not the mental part.
So we sent him home with
meds that will legitimately treat this immediate presenting problem.
Right.
But not necessarily the deeper underlying issue. And then they come back and they come back and they come back. And why does this cat keep getting UTIs? And why does he keep getting, peeing outside the box? He doesn't have a bladder stone. I don't understand. Well, it's stress, because your brain is in your body. So you can't really completely separate physical health from mental health.
And we spent so many years not worrying about mental health of pets that it doesn't even occur to some veterinary professionals still, even in 2026, that there is a mental health component.
And it's very sad, because it's not really getting a comprehensive picture of what your animal needs, what your pet needs.
Yeah. And the stressor in the house could be something very serious, but also could be
mental health,
something relatively fixable.
Yeah, or nothing. It could be just like some people have anxiety that's not caused by an external source. Your cat could too. So maybe you legitimately have given your cat a great home to live in, and they just were born anxious. That doesn't mean there's nothing you could do about it. There's lots of things you could do about it, but it's not so simple as, well, did you have a baby? No. Well, did you get a new cat? No. Okay, well then I don't know. Well, your cat could just be anxious, just like some people are just born that way. And there's lots of things you could do to help them, but it's not quite as like one to the other to the other. Oh, I had a baby. Of course the cat's stressed out.
So it's okay to say, well, my cat just has generalized anxiety.
It is.
And because of that, we get this urinary stuff that happens, but we know this whole picture.
Right.
So we can help the cat. And that may be medications helping with the mental health as well, if we are in tune with that.
Yeah.
Good. We talk, part of the reason that we even really started this is because there's so many pets that are so stressed at the vet and having such negative experiences that they're just not getting care. And I know one of the big things that has always been in veterinary medicine that we hear a lot about is access to care. But what a lot of veterinary professionals and consultants and speakers think about that is that access to care is only a financial problem. Like, I don't have the funds, so I can't go to the vet. So now I have no access to vet care because I can't afford it. And that is relevant. That is very legit.
Totally.
It is a problem, right? Pet insurance doesn't work the same as health insurance, and we have to pass pricing on to the clients. Like, there's nothing we can do about the state of that. But it's not the only thing that limits access to care, which is what we've learned a lot over the years. And still, in my mind, we still surprisingly hear it a lot.
As recently as yesterday, when someone said, oh, I think I should have brought her in a little sooner. We don't shame ourselves here, but that's okay. I get the feeling. But the important part of that is why. It was because the cat is very stressed out, and it was very stressful and upsetting to take her to the last vet. She hated it. She was very upset, and that's hard.
Yeah.
It's hard to see your pet like that and not know how to help them.
Yeah. So for us, stress is a big barrier to care. Yes, we're not trying to downplay the fact that money is also a barrier to care, but it's not the only thing.
It's not the only one.
Because there are plenty of pet parents out there that will spend the money, saved the money, budgeted the money, did whatever they need to make sure they have money to be a really good, responsible pet parent. But then they can't because it's so stressful. We go back to maybe they were shamed.
Yeah.
Maybe they're embarrassed. Especially dog owners seem to take that very personal, not as much cat owners.
No, they don't take it personal, but all the money in the world won't help you if you can't get the cat in the crate and get the cat to the vet.
Yeah.
So even though they don't take it personal, I think
there's only so much they can
there's only so much that they can do, especially if they're not getting that help and that support to make things better.
So stress is a big issue. And the other thing when we think about stress that occurs to us, I feel like we were just having a conversation about this the other day, is really noticing the difference between dogs and dog pet parents and cats and cat parents. And that, right, the cat parents are like, whew, got him in the carrier, got him to the vet. I'm good. I will sit here. I will wait. 20 minutes. Great. Yep, we're good. Because when they're in the exam room, they're not having to manage the cat or do anything with the cat. Like, the hard part is over for them. We sit in the exam room or on our phone. The cat's not stressed. In fact, the longer the cat's in the exam room, we're getting more acclimated to the environment. So this is great. They're having a good time. It's opposite for dog parents.
The management has just begun because most dogs do know how to ride in the car. Not all of them, but most.
They want to go for a ride.
Most of them do. And then, we don't have pets in the lobby, so they're waiting in the car in the familiar environment. Then they go into the exam room, and that's when you have to start managing your dog.
And the stress for the pet parent usually increases at that point. Because we can't just sit there and relax as our dog enjoys the environment. That we do have a good environment in the room, but that's just not the nature of dogs.
No, dogs tend to get more spooled up. They're like, what are we doing? Why are we sitting here? Why aren't we doing something? At least the anxious dogs, like my dog, who are also high energy, is like,
sure, some will just lay down.
What are we doing? Why are we here? Okay, we're out. We're doing, okay, let's go. Let's do something. Let's do some tricks. Oh, is someone out there? I'm going to listen and look out the door. And, hey, can I have one of those treats? And the cats are like, great.
The cats are in the cubby.
The cats are in the cubby, relaxing or exploring the room, but not in a way that you have to help them manage. They can just do that while you are relaxing on your phone or reading your book.
Yeah. So lots of stress because we talk a lot about that the pet parent is stressed also, and how can we help the pet parent, and are there things that we can do for the pet parent? And this is a question that if you have an answer to it, you could drop it in the comments.
Yeah.
Is there comments? Okay. What could we do in the exam room, right? we've got you here. Maybe your pet has their meds on board, and like it's okay. But now you get here and you're a little bit stressed. You know, is there something that we can do to help lower that just for you personally? You know, we have snacks and coffee, water, things like that. We've have one of our exam rooms has some things that you could use or take, just some self-care type things. But if anybody out there has any ideas of what else we could put in the exam room or other things that we could do, that would be awesome to know as a pet parent when you're sitting in the exam room, like, man, I wish I had fill in the blank. We'd like to know that something a little bit simple and basic and easy for us to have in the exam room, but that'd be good to know. But we really got to make sure we get a handle on the stress of the pets
and the pet parents
will help the pet parents.
Yes, because sometimes it's just my dog is winding up and I'm getting stressed out because he's stressed out.
Yeah, that's why the cat parents are over here, like just scrolling through hopefully our Instagram page and having a great time.
Because even a stressed out cat just usually wants to just hide in his carrier and acclimate. Even if they're stressed when they get here, it's good for them to just sit and acclimate, even if they don't come out and explore, even if they're just sitting in their carrier. The more time they're in there, the better. It would be ideal for the cats. We're not going to do this, but it would be ideal for the cats to be in there for 2 hours before their appointment. That's not realistic, but ideally, and I think a lot of cat parents intuitively know that. Like, gosh, it's unfortunate for me that I've had to wait, but he is actually getting better as time goes on.
Right. So it's interesting about the cats acclimating to the room for a couple hours. While we can't do that, I think we do want to look into the future to try to help get cats out more, because forever cats have only come out to go to the vet. We all know that. We all know that's why no vet clinic sees very many cats, except the cat only clinics, obviously, but no one sees a high percentage of cats. And you hear probably on a every other day basis that it was hard to get him in the carrier. They didn't come to the vet till he was sick because it's so hard to get him to the vet. That we're working on something to help and talking to clients about getting cats out more and really trying to acclimate them to
being out, to doing things, to, you know, seeing the carrier and not just thinking something bad is going to happen. Even the ones that come here and like it, it's still stressful to get in the carrier and get in the car. If you only do it
only time they leave
once a year, that's still a whole experience for them that they are not sure about. But if they, you know, we were talking about earlier, well, dogs usually like the car. Well, why is that? Because they get to go a bunch of places. Even if you're not outdoorsy, your dog usually goes to Starbucks or the bank with you, or, you know, leaves the house and goes on walks in the neighborhood. I mean, they go places, and we don't think of that with our cats. Their socialization window as kittens tends to be a little shorter, and also it's just not part of our reality most of the time that we're even going to do that.
Right.
Because you can also socialize an adult cat, you can socialize an adult dog.
It's a cat. So
it's a cat.
Done that,
and they don't. And we don't really think of it like that ever, because it's not part of the culture to take our cats everywhere with us.
Because even here, where we have the dogs come back for a victory visit and come back for an adolescent visit, we're like, oh, we know you don't want to bring your cat back. We wouldn't want you to have to do that. So we're going to teach you how to do this stuff at home. And now over the last couple of months, we're like, no, we need to get those cats back in here.
Yeah.
We need to normalize taking your cats out more often and helping clients understand that, no, cats can have a personality and they can be fun and they can get out. And then by default, they can have a better vet experience and potentially fewer behavior issues.
It really all ties together that, you know, if they're not going places, if they don't have the right enrichment at home, just if they are just expected to just sit there and be sort of a decoration, everyone thinks cats are easy. And in some specific ways, cats are easier. Like if you work long hours, you don't have to take them out to go to the bathroom. I mean, I'm not saying that that's not true. In some ways they are.
Yeah.
But they do need just as much attention and enrichment And socialization as dogs, it just needs to look different.
Yeah. So follow us on Instagram and you'll see more coming about how we're going to work on getting cats out of the house.
Both at Latah Creek AH and at Cat Dog Megan.
Yep.
And there's going to be some special things on both accounts to check out for this.
It's very exciting over the next couple months.
It is. And one of my cats has been voluntold to be the spokes cat.
Nice.
So he will be he's very cute, and you'll want to at least follow his journey, and hopefully it inspires you to do the same.
Yep. Little jinxie. So as we look to season 2, we have some exciting things coming up, and we'll be back September 1st. So mark your calendars. And transition may not be the right word. We've spent a lot of time working on fear-free and low stress and really figuring out how to really, really advocate for pets and pet parents.
A blossoming.
And so fear-free has taught us so much, but then, as many probably can see, we kind of have started to just kind of go, not necessarily our own direction, but like above and beyond and a little bit more advanced in what we're doing, which Fear-Free thinks is great. So we're just taking a fork in the road that leads us to what we're going to call Fearless. And it's really going to incorporate not just the stress of the pet parent, and really working with the community and having community allies and just helping pets be less stressed in a lot of different ways. And so we're very excited about that. The other big change is going to be some of the verbiage that we use. So we've spent a lot of time saying PVPs, pre-visit pharmaceuticals. A lot of people still, clients, people, professionals that we talk to still forget what that means. But what we find ourselves saying a lot is calming medications. So you're going to see a switch to us using the verbiage calming medications. And then probably the biggest switch that I'll let Dr. Megan talk about here for a minute is, we'll still obviously focus on the fear, anxiety, and stress and the scores and things like that, but we're going to also incorporate another, different levels that will be more in line with human mental health. Do you want to talk about that?
Yeah, like you were saying earlier, comparing it more to our mental health, because in a lot of ways it is quite similar, just in terms of the science of it, the nervous system, the regulated or dysregulated nervous system, because you can be dysregulated and not necessarily be anxious or stressed. I mean, it can tip into stress. For example, those dogs that are so over the top happy to be here that they get overstimulated, and then that can become stressful for them just because they don't know what to do with themselves. So it's not really fear, anxiety, and stress.
Right, it's not on the fear-free scale.
It's not on that scale, because genuinely the emotion that started it all was happy. And they can become stressed just because they don't know what to do with themselves.
So then we had a hard time figuring out where to put them on the scale, and talked about doing our own scale to account for them.
So then all of them, it's more of, is your nervous system regulated or dysregulated? And so that could be, I'm dysregulated because I don't want to be at the vet, or I'm dysregulated because I do want to be here so much, or I'm dysregulated because I saw a scary guy with a hat on the drive down here, and there's actually nothing to do with the vet, but it's one of my other triggers, or I heard a dog barking, not at our clinic, but on the car ride, or something like that.
So you'll hear us talk a lot about regulated, alert, we might be escalating, over threshold, and dysregulated, and we'll have a couple different levels of dysregulated, because again, some might be happy dysregulated, but some are very truly what we would call FAS5, dysregulated, reactive. We have obviously the whole spectrum, but this will help us better encompass every single one of our patients.
And at some point, I think that, like we were talking about for the dysregulated ones, the separation needs to be different, because the dog that is going to fight, you've probably heard fight or flight. There's also freeze, fidget, and faff around. But if you're up to fight or flight or freeze, really your emotions are the same. You're just as dysregulated. And so, yes, of course, lots of the attention goes to the ones who are in fight mode because someone could get hurt.
Right.
Not that it's a bad or a mean dog necessarily, but someone could get hurt. That's just the truth.
Yeah.
However, that dog who is so frozen with their face in the corner, who it wouldn't occur to them really to bite you because that's just not how they're hardwired to deal with stress, is just as upset.
Yeah.
Just as dysregulated, but they're just showing it differently. And so I think it does them a disservice to give them maybe what on the old scale would have been like a 3 or 4, but really they're just as terrified. They're just not going to bite you.
Yeah. Yeah.
So we've separated that out a little differently, more by how they're feeling on the inside.
Yeah. So we just felt that there was room for growth in those levels, and we just couldn't. It took us a while to figure out exactly how to incorporate that. And then just the verbiage, because still after all of these years of doing this, many, many years at this point in 2026, is clients not really understanding the verbiage that we're using. And we are using our scoring system and we're talking clients through it, but it's hard when yourself as a person your mental health isn't scored from a 0 to 5, right. And we use these words like I'm overstimulated, right? Like those are words you will hear us say more of those words here in the next few months when we officially launch this.
Trying to get away from numbers and acronyms. And yes, we do have our own specialized verbiage, but it's very accessible. Like you said, very related to human mental health, no acronyms, no numbers, just descriptive.
So while absolutely nothing will change about what we're doing in the clinic and how our environment is and how we're treating our patients and pet parents, just the way you'll hear us express it is going to be different and hopefully more relatable.
Yeah. And hopefully it will make more sense to everyone, including those who, whether that's clients, the community, or other professionals who have never heard of Fear Free before. That this may just be more immediately understandable.
Yeah. Had a little microphone malfunction.
But we're back.
Yeah.
It's okay.
Yeah. Okay, so lots of exciting stuff for season 2. Again, that will be on September 1st. And so before we wrap up, did you have anything else you wanted to add?
Yes. We would like to do something new this episode, something different that we're going to continue to do, but we'd like to share our very first business spotlight for another business that cares about the mental state of pets. Blake, the owner of Modified Canine, hosted his very first vet prep class. We just finished up the first session and we were super excited to be able to help with it. Dogs could learn what to expect at the vet and get used to the kind of specific handling that happens in a vet clinic.
And Blake, there are specific trainers and groomers and boarding facilities and stuff that we need to refer to because we need to be careful of who we refer to for Fear Free. We need to make sure that where they're going, it's low stress. And Modified Canine isn't one that was on our radar. I mean, there's lots of trainers in Spokane. He isn't one that was on our radar. And, he has different ways of training. Everyone has their own ways of training. But he contacted us and said, I've always wanted to do this class. So then, of course, we look into Modified Canine and how he does his training. And it looked like he did a good job, at least on social media. But, do you trust social media or what? I don't know.
Who knows?
So we talked with him. We met with him. He explained to us this idea about this vet prep class, and it was really awesome. And we're like, yeah, we're going to be in, because even though you've not really heard of Fear Free or low stress, he had his own stressful experience with his dog at the groomer where he had to tell the groomer, just stop, because my German Shepherd will bite you if you don't stop trimming her nails right now. You're not going to hold her down. You're not going to win this.
Right.
And so because of that, he just felt there's got to be a different way. And then he did his own research and reached out to a couple of the Fear Free certified practices. And we were lucky enough to be chosen as the one he wanted to work with. So we already had a complete session one of 6-week session where we had some really good wins from one very specific patient. And so a new class is starting up April 28th here in Spokane, Washington, if you're local. If you're not local,
ask a local
contact a
trainer. Yeah. And one thing I think that we decided is we don't necessarily have to agree on every single training aspect
There's too many
that might ever happen to be able to come together and help the pets have a lower stress experience.
Yeah.
Because I don't think there's any trainer that is going to 100% agree with another trainer.
Right. But what we can agree on, I mean, there's one key thing that we agree on, and that's really all that matters to us, is that he felt in his soul that dogs should not have to have such a stressful experience, vet, groomer, wherever they're at. So he has unknowingly initially created this class to help, and then he didn't realize it would line up with fear-free and low stress and the stuff that's already out there, and it lines up perfectly. So yep, we're here to help him and collaborate on that with him, and so it's very exciting.
Yep. And I hope this class takes off, because another great thing that then can happen is if a client of a vet practice who maybe hasn't heard of this before goes to Blake, takes the class, goes back to their vet and shows them some progress, that's going to open up some minds there as well of things that are possible.
Yeah, and it did to a small degree for our little dog B who was in the class. She goes to a different vet clinic, and by the end of the class, the vet clinic wanted to see the video of how we were successfully able to give her vaccine, and so she was able to get her vaccine, and they were at least willing to watch the video and participate to a degree to make sure that was a low stress experience for B. So that was exciting.
It was super exciting. I think even a lot of veterinarians, veterinary clinics, vet professionals who don't want to put the time in to try to make these ideas and these protocols quite understand
it means.
If I think most of them will participate with, I need you to come here, stand here. I'm going to give her this treat and this cue, and then you give the shot. Because if it's plug and play, there's really no reason not to, even if it's not your passion to generate these ideas. Certainly most veterinarians will listen.
And that's what we were telling the pet parents. Like, just go ask them. Ask them, and most would accommodate that, I think. Yeah. Okay, well, is that a wrap for season 1?
I think that's a wrap for season 1. I have one thought to end on that I want everyone to think about over the summer.
Okay.
We sort of already touched on it, but pets deserve for you, the pet owner, to be regulated as well.
Yes, they do.
So think about what you can do to be more regulated yourself, because by extension, that will help your pet.
Yep. Because the stuff travels through the leash.
Yep. Both ways.
Yep. Both ways.
All right. Well.
Okay. Well.
We'll see you next season.
Do you want to talk about the show notes?
As per usual, links will be in the show notes to our Instagrams, and
we'll have a link to Modified Canine.
Modified Canine, and everything we talked about during the episode will be in the show notes, with also a few Easter eggs in the show notes for some, not Easter eggs, but links to some of our viral videos that you can check out.
Yes. Okay. We'll see you in September.
Bye.
Bye.